that you are the change makers of India. This is one because we are getting new diagnostic techniques, we are getting newer diagnostic tools, we are getting better and better drugs, new class of drugs. And that's why we are winning small battles. And it is the youth which will explode with diabetes. And you should be at the forefront of the war against diabetes. If we want to overcome the war against diabetes, we have to ensure that we need to have affordable, accessible and available drugs. You are the next generation and you are the future of Indian diabetes. You are the future of healthcare. You are the future of India.
Welcome you all to this D-Genius podcast. So myself, Dr. Shambo Samajdar, I am a D-Genius doctor, and today we have with us none other than Professor of Professors, Dr. Shashank Joshi, who is a renowned endocrinologist in this country. He was the past chair of IDF Southeast Asia, and we are really delighted to have him with us. So, sir, for us, the D-Genius members, would you please tell about the South Asian phenotype? What the specific focus of us as physician when we see our patient?
So, Dr. Shambo, first of all, I want to congratulate you and the entire community of D-Genius. You are the next generation and you are the future of Indian diabetes. You are the future of healthcare. You are the future of India. And I think the health of the nation is in your hands. So I congratulate you for all the effort and work you do in terms of advocacy, education, research and practice. So I'm delighted and excited that you are into this extraordinary endeavor. Now, Shambo, you asked me a very pertinent question that what is the Asian phenotype? And as we know, compared to the African Americans or Caucasians, we store more fat in our body composition. So we have something called as a thin fat Asian phenotype, where we have less muscle mass, more fat mass. So the muscle to fat ratio is altered. And typically when the phenotype is evolving, you get a classical dyslipidemia, you get hypertension, you get coronary artery disease. And it's an evolutionary phenotype because our ancestors had a lot of poverty. And there were times when we had famines in the country. So we were a fasting and a feasting country. And in the times of famines, we developed evolutionarily a fuel storage gene around our abdomen. And that is why traditionally Asian Indians have abdominal obesity, which is the harbinger of insulin resistance, which eventually leads to hypertension and dyslipidemia, as well as coronary artery disease and type 2 diabetes. And the prime driver of this ectopic fat or extra fat around the abdomen or the liver is detrimental to health. And I think that is the key. And it is also known that this insulin-resistant Asian Indian phenotype is more coronary prone. They have a typical dyslipidemia where the HDL is very low, the LDL is very low, and the triglycerides are very high. So this is how the phenotype evolved. We respond differently to physical activity. We need to build more muscle mass, so we need muscle strengthening exercises. We need to eat less, eat on time, eat right. We definitely need to sleep well and do digital detox. And we should focus not just on outcomes which are health related outcomes. And we have to move and digress beyond just glucocentric outcomes to cardiac outcomes, renal outcomes, metabolic outcomes and various others. And that is the compelling need today. And it could occur through lifestyle, it could occur through medications, it could occur through interventions. So clearly there is a phenotype, clearly we have a solution, and diabetes, as I said, Charles Dickens said, we are in best of times but worst of times. And also I would say that diabetes is a battle won but a war lost. The battle is won because we are getting new diagnostic techniques, we are getting newer diagnostic tools, we are getting better and better drugs, new classes of drugs. And that's why we are winning small battles. But in the large picture, people living with diabetes, despite of so many advances, are still dying earlier than normal people. They are getting complications. And clearly the numbers globally and locally are expanding. And therefore, we are, though winning many battles, we are losing the war. And therefore, in the war against diabetes, we all need to come together, and I would request the Genius Group to put their minds and efforts together in their war against diabetes, so that not only we win battles against people for their better health living with diabetes, but they also win the war eventually.
Thank you, sir. Sir, in that way, we are seeing lot of our patients who are very young but diagnosed with type 2 diabetes, obesity. So, what is your message? How we should approach to our adolescent population?
Sambo, that is very right. We have a second peak in the adolescent age group because between class 8 and class 12, we have stopped doing physical education. We do double education from classes. We have become more sedentary. We are eating a lot of fast and fried food, and we are not sleeping adequately, and we are digitally intoxicated. All this 4 or 5 years of intense schooling and college and peer pressure to perform and excel in the brain power is actually compromising on our health equation. And when the health equation is disturbed, our adolescent children who are growing, they tend to get obesity, they get ectopic sites, they get insulin resistance, and eventually this propels a vicious cycle. And this vicious cycle will eventually lead to type 2 diabetes, heart disease, and many other things. So this is something which we need to hit hard and hit early. And it is the youth which will explode with diabetes. And it's an interventional target. And we need to be mindful of that.
Yeah, right, sir. So, as you were talking about evidence-based medicine, and what would be your message towards our D-genius doctors who are keen in clinical research to develop some evidences from our country? So, what is your message, sir?
So in the research world, there is a saying, get publish or perish. But in the practice world, most of the research which is published is in randomized controlled trial environment, which is an artificial environment. But you are real life practitioners battling with people living with this disease day in, day out. So you need to generate the real world evidence. Real world evidence could be observational, could be a case cohort study, could be a prospective follow-up study, and could be a little better designed trial in a small population or a large population. Despite of diversity in our geographies, despite of diversity in food, habits, etc., we need to recognize that D-Genius as a group, united we stand, and you are the harbingers, and you should be at the forefront of the war against diabetes. If we want to overcome the war against diabetes, we have to ensure that we need to have affordable, accessible, and available drugs, as well as strategies in place. We need to be having intensive lifestyle strategies. We need to monitor properly. So it's not just only giving medications. It's about a equation in which lifestyle is an integral component, behavioral change is equally important. And eventually we are looking at health outcomes. But health outcomes are not sufficient. You may get a health outcome, a glucocentric outcome, a CV or a renal outcome, a liver or a brain outcome. But beyond that, we also want happiness outcome. So if you want to live long with diabetes, you should try to aim to be complication free, and you should live happily with the appropriate lifestyle rather than being negative and bombarded and intoxicated with meds and with stress. So I think the key for D-Genius is that you are the change makers of the India. You are our brand ambassadors on the war of diabetes. And therefore, I would urge each one of you to become brand ambassadors for the International Diabetes Federation as well as various other bodies, so that you can fight the war against diabetes as a disease, not only at individual patient care level, but also at a population level, because your word of mouth carries more weight than anyone else.
Thank you, sir. I think we D-genius doctors will be really get encouragement from these enthusiastic words from none other than Professor Shashank Joshi. His wisdom will definitely inspire us. So he had emphasized how we should provide an overall efficient care. When we talk about efficiency, it is not only talking about efficacy or rather effectiveness, it is a wholesome product. So we will end our discussion with some key message from you, sir, because we D-genius doctors are making our clinic now, preparing our clinic. So, what is your take home message for us? What should we practice in our day to day clinic?
So I think you should practice what you preach. So my message to my brothers and sisters from the D Genius group is, you all are the next generation and you are future of India. Invest into time, invest into team, invest into education and research, and be empowered. Knowledge and wisdom are two different things. You may have a lot of knowledge, you may have a lot of education, but you need to have compassion, you need to have empathy, you need to have good communication skills, and you need to ensure that whatever you observe and whatever you practice, you ensure that you generate some science and evidence around it, and you should also be healthy and happy. It is equally important that you should not go through a burnout, because D Genius, being so genius that we all try to undergo a burnout as a doctor. And it's very important that you should take care of your own health, your family members' health, and always be happy and healthy, and always be positive. Whatever happens, you should know how to handle adversity. You should give confidence to your people living with diabetes so that they can have healthy and happier lives. They can have longer lives without complications. And you should also stay healthy and happy and not get overwhelmed and overburdened because of the pool of population which you are seeing. You are the caregivers, you are the prevention tools of the world, and you are the forefronts of the battle against in the fight for diabetes. Particularly, we want to have a complication-free world without diabetes. And without your support, without your geniusness, we will never be able to win this battle.
Thank you, sir. And I think this year the theme of Diabetes India Congress was strengthening diabetes care in India. And we are really delighted to have today with Professor Shashank Joshi, sir, who had encouraged us to promote an efficient diabetes care in India, where we should follow the mantra of effectiveness of the therapy, patient-oriented evidence generation, and along with the empathy. So thank you once again, sir, for giving us time. Thank you
and
all,
Jai Hind.
D Genius. Jai Hind.